Hey guys, and welcome back to my channel. So if you're an international student who has just finished their degree, or you're someone who's permanently employed already but you need to find a way for you to make extra shifts, make that extra moolah, then continue watching this video because I'm going to be covering all the things you need to know about applying for agencies, the whole process of getting shifts, and also the pros and cons of working for an agency compared to being permanent. So if you are interested in this video, then continue watching. Okay, so first of all, what is an agency? So an agency is an organization that is affiliated with an institution, usually a hospital, an old age home, a clinic, etc., and provides the institution with manpower or the nurses. So a nurse that is working for an agency becomes an agency nurse. In America, this is what they usually call your travel nurse, where you're not permanently situated at one facility, you move around. So you become an agency sister. So if an agency sister and agency nurse, you are now a healthcare provider who provides services for a number of different organizations. The agency that you are signed up with liaises with healthcare organizations and offers the nurse, which is you, a temporary assignment based on your location and specialty. So this is now a relationship that you're creating between yourself as the nurse or the healthcare provider, the agency, and the institution that you're going to be working for. So you have the skills as an ENA, an EN, a registered nurse, and you're now saying to this agency, this is my skills and this is where I want to work based on your location. You can make it as free as possible, but based on how far you want to travel. Then the agency lines you up with the need of the hospital. So the hospital will say we need ENAs or we need ENs or we need RNs to be covering this certain ward or this certain part of the hospital, the clinic, etc. And then now the agency tries to line up with the needs of the hospital, the skills that the nurses have. So essentially, the agency is the middleman between you and the hospital, the clinic, the old age home that you're going to be working for. So there are 5 things that affect how you will choose which agency you're going to be working with, because there are thousands of nursing agencies that you can sign up with. So the 5 basic things that you usually look for is, number 1, the institution that agency is affiliated with, whether they're affiliated with a private institution or a government institution or an old age home. And some agencies can actually be signed up with all of them to provide more work for the nurses that they have signed up. So the next thing is the pay rate. Each different agency pays their nurses a certain rate based on the relationship and the contract that they have with the hospital, clinic, etc. And also depends whether you're going to be working in private, an old age home, or government, because they all have different rates. For example, you might be signed up with one agency where their rate for a public hospital is 80 Rand an hour, whereas if you're working for a private hospital with that same agency, they will pay you 120 Rand per hour, and then at an old age home, they might pay you like 70 Rand an hour. So each different agency has a different rate with the different organizations that they're affiliated with. So this is why most people will usually look for the agencies that pay the most, because you obviously want your time to matter and your time to be worth it. Because if you're working for an agency, they pay you according to the number of hours that you work. So the more hours that you work, the more money that you make. So obviously you don't want to be working a lot of hours, like 12 hours and so forth, and you're getting paid little compared to someone who is working with a different agency where they can work the same number of hours but being paid more. So this is how it affects which agency that you're going to be using. If you go down in the description box of this video, I'm going to put the different agencies that I know and their rates and other extra information about those agencies. If you're interested in that, that will all be in the description box. So the third thing that you have to look at when you're looking for an agency is the reputation that agency has, because a lot of agencies have gotten into trouble for registering nurses that are not registered with SANG. There's also some agencies that have gotten into a lot of trouble with media where they've hired nurses that are still under disciplinary hearing and so forth. So it's very important for you to be very sure of how your nursing agency vets their nurses and also the different institutions that they're affiliated with. Ask people around, ask other nurses that are already working with those agencies and so forth. Trust me, people will tell you information about the agencies that they are working with, because we're all helping each other. And also we've all had different experiences with these agencies. So people are more than willing to tell you what the agency is about. And I'm also here to tell you what it's all about. The fourth thing you also have to look at when you're looking for a nursing agency is the likelihood of that nursing agency giving you shifts. So there was a time just before I signed up with the agency that I'm with now, where I signed up with agency, cool, it's going great, and they are affiliated with old age homes. And we were now put into this group where there's like 300 RNs, and they would advertise one shift every single day. So now imagine all 300 of us trying to get this shift all at the same time. So you can just see that the amount of nurses that they had compared to the extra shifts that they had was very little, and that also means that you're not going to be working for a really long time because that agency doesn't have enough shifts. So it's very important for you to sign up with an agency that is affiliated with bigger hospitals, because the bigger the hospital is, the more likelihood that you will have shifts and you won't be sitting at home all the time. And the last thing to consider when looking for an agency is the terms and conditions. Each agency has different terms and conditions depending on the relationship that they have with the institutions that they have, and also with the framework of that nursing agency. The main things that you need to look out for is the deductions that the agency is going to take, and also the leave days. Because with many agencies, they say you must work a certain number of hours and then they'll credit you a certain number of hours leave. For example, with most nursing agencies, they say for every 26 hours that you work for them, they will award you with 1 hour leave. As you can see, it's pretty messed up because essentially you have to work about 2.5 shifts for you to be accredited with 1 hour leave. So that means for you to be able to take 2 or 3 days off, it means that you need to have worked a lot of shifts for the agency. So that is just one of the many terms or conditions that you have to look out for. The other thing you also have to look out if the agency is going to be paying for your malpractice insurance, because with every healthcare professional, yes, you are covered by SANG, because SANG will prove to the institution that yes, you are a registered general nurse, psychiatric nurse, and so forth. But in case something happens while you are practicing, the agency needs to be able to represent you, and they need to be able to cover your court expenses and so forth should something as crazy as that happen. So your agency need to cover you for that malpractice insurance. Then the other thing is you also need to check the deductions that the agency is going to take. So there's different forms of deductions that the agency can take. The main one is they usually take 15% of the pay that you're getting, which they take for themselves to cover your tax and also for them doing the work for you to find shifts. However, this is only if that is the agency that you are working with. If you're working with multiple agencies, you have to reveal this information that you're working with multiple agencies, and as a result, the deductions have to increase a bit to be able to cover the tax that you're going to bill out because you're using different agencies. The other thing, if you become permanent and you're still doing shifts with the agency, then the rate becomes 26%, because one, the permanent post that you're doing is going to be taking tax for the work that you're doing for them permanently, but also because they've now added the extra thing of working as an agency, they also have to increase their tax so that you don't owe anything to SARS. So it's very important that you are aware of the number of deductions that they're taking. I know a lot of people usually don't reveal this information to the agency so that it stays there, but trust me, once your tax deductions and your tax report comes out, you're going to be owing SARS a lot of money. So it's very important that you're transparent about this information. So it's very important that you also find out how much the deduction is that the agency is going to take from you, because trust me, you will feel it when those deductions come out. For example, with my agency, they pay you every Thursday. So the shifts that I worked last week, I'll get paid this week Thursday, and every Thursday they'll give me a pay slip and it will show how many hours I worked, what is the actual amount that I earned that week based on their hourly rate, depending on whether it was day shift, night shift, or weekend, or public holiday. So I will know how much I actually earned, but the only money that comes to my account is minus deductions for their own labor and also for the tax. And trust me, the difference is quite tremendous. So it's important for you to be aware of how much percentage they're taking as deductions. So once you're aware of all these terms and conditions that come with choosing an agency, and you have selected the agency that you want to work with, there's a number of different ways that you can go about applying. The easiest one is for you to go in person, because if you go in person, everything gets done on the day and you can start getting shifts as soon as possible. However, some agencies, they first want you to apply online. You put in your information, your SENC documentation, your ID documents, and so forth, and then they'll ask you to do a test. So they will have a test for an ENA, they'll have a test for an EN, and they'll have a test for an RN, because we're all being tested on different skills. Personally, I don't think the tests are hard. A lot of the questions are scenario based. So they'll tell you a patient just came back from surgery and they had a knee operation. What is your immediate action after a patient comes back from theater? So that's you doing observations and so forth. So depending on your rank, they'll obviously choose a certain part of a scenario. For example, with an ENA, after a patient comes from theater, your main focus is for you to make sure that you get their vital signs done. For an RN, it's possibly continuing the fluids from theater, following the doctor's orders, giving pain management, and so forth. So it's not something that you have to study extremely hard. It's basic stuff that you've been doing for all the 4 years that you've been a nurse or been a student and so forth. It's also open book, so you really can't fail. But trust me, you don't even have to Google anything. The only thing that I'd say is brush up on is your drug calculations, your dosage required over dosage in stock times volume over 1. That is one main thing they're going to ask you. And also, I think another tricky question they asked me was about when you're documenting drugs in the drug book, like your Schedule 6 and Schedule 5, they were just asking about, you need to make sure that you have the doctor's name, the patient's details, your signature, someone else needs to co-sign with you. That's like the hardest one. So after you have that test online, then they'll ask you to come in with your documentation. I'll put the documentations over here. Please take a screenshot. I'm not going to go through all of them. It depends on each different agency, but this is the basic ones. So after you've gone in to do your documentation, you've given them your documentation, you've done your test, then most agencies will give you your identification card on that same day. So the identification card will obviously have your face on it. They need to have your details, your SANC number, and also the company number. Please make sure that you memorize this company number, because for every single timesheet that you're going to sign in at the institution that you walk into, you need to have the correct company number, because if they can't identify you with your company number, trust me, when your money needs to come in, they're going to say, well, we don't know who this person is, and they're not going to tell you. So please make sure that you put in the correct company number. So please make sure that the agency organizes orientation for you. Because one, it's a safety issue. If you're going to walk into a place as an agency system, you're not permanent. The sisters there or the nursing staff there is already anxious that they have someone foreign in their workspace. So they're usually very iffy, especially if you're an RN, about giving you the drug keys, about making you do doctor's rounds because you don't know who the doctors are and stuff like that. So there's already a lot of hesitance that you get from the nursing staff there. So please make sure that your nursing agency at least orientates you in that place. It's usually 2 or 3 days in that work environment that you potentially will be working in, or just that hospital in general, so that you're aware of your escape plans, you're aware of how they do their medication, you're aware of the documentation that you have to sign, and so forth. And trust me, it makes the adjustment so much easier into that place, because you are aware of how the nursing staff works, because each nursing ward, they do things differently based on their own circumstance, the type of patients that they have, the type of doctors, and so forth. So it's very important that the agency orientates you to that hospital. And if you're going to be going into private hospitals, you're also going to need to be trained in how to use their online system. So that's another couple of days added to your orientation for you to get orientated to that. The other thing that your agency might also have to organize for you is your BLS training. For most of us, during our university years, we've done our first aid training, which was first aid level 1, We know about the emergency trolley. We've done the whole CPR and so forth. And for us, we did our CPR in second year. By the time I graduated, my first aid certificate didn't count anymore. So it's important for you to have that BLS training organized for you, because trust me, when you need to do a resuscitation, you need to know what's happening. You need to be very clued up on how to do things. Because as I already said, the nursing staff is already so hesitant of having someone who's an agency staff, because you're not part of the team yet. So if you know your staff, you've been trained in it, they'll be more comfortable to let you do stuff because they know that you're competent in it. The other great thing that your agency might do is, once you've been orientated into that ward, that hospital that you're going to be working in, they'll come here and they maybe once a week, once a month, to just see your progress in that ward, and they'll also show you other things that the nursing staff might not show you that happens in that ward. For example, with me, with my agency, luckily enough, the person who was sort of my mentor, she was part of building the hospital that I'm currently working in. So she knows literally everyone in the hospital. She knows the ups and downs of these wards and stuff. So when she comes, she literally shows me about things that happen in the ward. You must do this and so forth. So it's great to have those mentors. So if your agency signs you up to a mentor, trust me, make use of them. It makes you more aware of what's happening in this hospital and the whole process that goes with you adjusting into that ward, and it will make it so much easier for you to be able to get into the work system with the nursing staff that you're going to be working with. Okay, so once you're orientated, then they'll make you sign your contract. So the contract really covers the basic stuff that I spoke about earlier, about your pay cut, your deductions, and so forth. The other thing that your agency might want you to sign up for is the HIV protection. So if you have a needle stick injury, usually the hospital will assist you with that, but also the agency needs to be able to cover the cost of you getting your HIV test, for you to be having bloods, because after 6 weeks you need to go have another blood test, the medication that you're going to be on, and so forth. So your agency needs to be able to cover you for that. I've already spoken about the malpractice insurance, and then they're also going to need to do a background check. So they're going to take fingerprints. So those are also costs that will be covered, and also the name badge that they give you will also be another extra cost. So those are the few things that your agency might require from you, and a few things that you might have to pay for. At the beginning of this whole process of signing up for agency, it's going to be a lot of days that you're going to have to sacrifice for you going into the agency to see them, doing these fingerprints, doing this orientation, getting all this paperwork done and stuff like that. So what I can tell you from my experience is, do not be in a rush to go in today and tomorrow you're getting shifts, because trust me, it doesn't work like that. Like for me, with my experience, I signed up with this agency in March and I only started working in May. So it does take time, and also because you're a new nurse, the agency sometimes struggles to get you into shifts, especially if you have no professional experience, you just have student experience. So in the beginning, trust me, you'll be stuck working in surgical and medical. It will be very hard for them to put you in like a specialized unit, like your cardiothoracic wards or in your maternity and stuff like that, because they obviously want to see how well you work in the general wards, because medical and surgical is very easy to get into, because medical and surgical is basic nursing stuff, so it's much easier to get into it. And once you are more exposed to that, then you're more than welcome to start venturing out into other disciplines. Okay, so now coming to the part about getting shifts. So depending whether you don't have any work, like you're a new graduate or you've been unemployed for a while, etc., and if you're permanent, that will affect how your shifts are going to work. So in the case of someone who is not working at all, you literally can tell them, for this month I'm free, book me, and they'll book you. Most agencies, they either book you on a day-by-day basis. That is the most annoying process of it, because you literally could be going on about your business during the day and they call you, oh, hi sister, are you perhaps able to work a night shift today? And if you haven't been working and you need the money, you accept. Whether you slept during the day, you didn't, that's not up to them. You will go. The other thing is, if they need someone to go to a hospital that morning, they literally can call you at 6:30. Hi sister, we need a sister for this and this ward. Are you available? If you're available, and you go. And the annoying part about that, or being called in the morning, is when you arrive, the institution is not going to say, well, the shift started at 7, so you can sign 7 to 7. If you arrive at the institution at 8:30, 9:30, whatever, you write 9:30 and you finish at 7. And since you're working on an hourly base, that will affect how much money you get because you've started late. So that's the only annoying things of being called on a immediate response type of thing. If you are lucky enough, they can hire you a week in advance or a month in advance. The month in advance one is nice because you can literally plan out your life. You can say, okay, on this day I'm working this shift, then I can do my other personal stuff here. So that was the biggest challenge that I had in the beginning, because the shifts were not as regular because I was slowly getting into it, and there was very few shifts that I could qualify for. As a result, they would call me that morning or that late afternoon for me to come. And as a result, I was accepting any and every shift that came my way. And that sometimes led me to working sometimes 7 days in a row, because I'm like, next week I might not get a shift at all. So let me get as many shifts as I can this week, so that even if something doesn't come next week, I'm covered. Because that was the hardest part in the beginning, is 1 week you have shifts, things are popping, you're working left, right, and center, and the following week, crickets, it's quiet, no shifts, nothing. So yeah, in the beginning it is going to be very frustrating like that. But yeah, once you slowly get into it and they trust you more, then they're more than happy to give you a month shift or 3 months, etc., depending on the hospital's needs. If you are lucky enough and you end up in a ward where they don't have someone for the rest of the month, maybe someone went on maternity leave, then you literally fill in that person's schedule. So if they're working Monday, Tuesday, then Friday, you would fall into that same thing. And this is what happened to me with the hospital where I'm at right now, where I filled in someone's shift. So when it happens like that, it's nice. Then you know that you're following the normal routine of a nurse's schedule, every 2-week cycle, and so forth. So that process is nice. So even someone who is permanent at another hospital and you're wanting to get extra shifts, in most cases you're going to be taking shifts as they come, or you can tell them in advance that this is my schedule, the 2-week cycle thing, and you tell them to fill in the gaps. It's great if they find a shift for you that's the opposite of your own shift, but in most cases it doesn't happen like that. So usually just have to take shifts as it comes, but speak to your agency. And also there's different people, different personalities in your agency, so you just have to find the right one that's going to line you up with the right shift, the right hospital, and things eventually come together. Because for me right now, I've got the normal 2-week cycle shift at the hospital where I'm at, and then at another hospital I've got another shift, but that one is 7-4. So on my off days I can go to that other hospital, and so forth. So if it works like that and you can merge the two, beautiful, it works out. Okay, so now you've discussed with the agency, they're giving you shifts and so forth. When you arrive at the institution, please make sure that you've got your ID band, the one with your company number and your SANC number, because they need identification and show proof. Yes, this person was booked for this shift and it matches up with the ID band. The same way that as students, we have to have an ID band to show what institution we're from and sort of thing. Please, it's the same thing. Yeah, just it's the same thing. If you're working in private, there's a clock in system where your fingerprint gets signed up. The time that you arrive, you clock in. It checks the exact time that you clocked in, and also when you leave, you clock out, and that's how they calculate your hours. I feel that system is a bit more efficient, and also if you arrive a little early or you leave later on after your shift, they will actually pay you for that extra time that you have taken still being in their facility, which is nice compared to the ones where you have to write down. You really have to write down to the T what the hours is, and yeah, it's a whole thing. So the clock in, for me personally, I feel it works magnificently. And the other thing you need to know, when you're getting paid, they don't pay you for the shift that you work that week. They'll pay you the following week. So for example, if this week I work Monday to Friday, then next week Thursday they'll pay me for last week's shift. So it's very important for you to keep track of the hospitals that you're working, the shifts that you're working, whether it was day or night, 7-7 or 7-4, and also the ward, because some wards they might give you a little extra because it's a high risk, like your psych wards or your ICU. They'll pay you slightly more than compared to the other wards, and also your night shift rate is different to your day shift rate, and also weekends and public holidays have got a different rate compared to the other days. So it's very important for you to keep track of your shifts and if your money is correct. So because I've had cases where I've worked and the money that comes in doesn't match up with the number of days that I worked, and you have to go query it, because sometimes the hospital itself, they turn in their timesheets late, so obviously that delays your pay. But please be very vigilant in your timesheets and making sure that everything gets paid on time and it's the correct one. Okay, so now that we've covered the basics of how you apply for an agency, how you start getting shifts, and the whole admin process that goes with it, I'm going to be sharing with you guys the pros and cons of working for an agency and what I've experienced, the things that I've liked about it and the things that I've hated about it. Obviously, this should not derail you from working for an agency ever, but it is things that you need to be aware of and you need to be cognizant of it, and just, toughen up. You need the work, you need the money, but yeah, these are just uncomfortable things that you have to go through. So I'll start with the positive side, obviously. So the first pro is the freedom that comes with you choosing your schedule. As much as you might not get shifts and so forth, if you're getting shifts, you have the freedom of saying no. So for example, if you have a program, an event, some sort of personal commitment that you need to attend, you literally can say, I'm not available on this day, and you don't go to work and you go attend your event. Compared if you are permanent, you have to ask for a leave and so forth, and also if you don't have enough leave days, then it's unpaid leave, then it's a whole thing. So the freedom of choosing when you work, whether you're going to choose only day or only night, or you only work weekends, or you only work in certain wards and so forth. So that freedom of choice is really great. But obviously you have to weigh the pros and cons of letting go of shifts compared to taking on shifts. But yeah, just the freedom of creating your own schedule is great. The next pro is being exposed to a variety of specialities and hospitals. So the agency can put you in a public, government, or in different wards based on obviously your skills and what you're trained in. Obviously your other specialized wards they might not put you in if you don't have experience in, but they can put you in medical, surgical, general ward, peds, and so forth. So just that freedom of being able to move around and not being stuck in one ward is amazing. And also you get to gain experience in different wards and specialties that you can use in the other ones. So just that whole thing of grasping information from different wards, for me it's been really amazing, especially for someone who's just come from being a student. I need as much experience as I can get. And one way this has worked in my favor is when I started, I could not do drips for the life of me. IV insertion was a mission and a half. So I happened to get placed in a hematology clinic at another facility. And in this hematology clinic, we literally put up drips every single day. Every single patient that comes in, they need to have a drip in. Then they get fluids, then they get their chemo, or they get their blood, platelets, and so forth. So for every single patient that we had, they had to have a drip. So obviously I had plenty practice. I do apologize for those that I pricked so many times and I couldn't get in. But trust me, with me pricking more people, the better it got. And now top notch, like 10 out of 10, most of my drips work all the time. So that has now helped me in my other hospital where I have to put up drips. It's not as frequent, but when I do it, it's mostly successful, which is great. So obviously being exposed to different wards, eventually they'll help each other and they interlink each other, just helping you to gain more experience as you go through this whole thing of gathering professional experience that they need you to have. The third advantage is you get paid weekly. Trust me, it's nice because every week you have money. Every Thursday I'm excited because I know my money is coming. However, it does come with a bit of a problem with it. because obviously you think you have more money than you actually have, because like, oh my gosh, this week I have this money and so forth. But you also need to remember that at the end of the week, at the end of the month, you have expenses. So every week you need to be making sure that you are saving accordingly so that you can cover your expenses at the end of the month. So that's just the annoying thing, because gathering money or having a lot of money is a lot more difficult, because in most cases you end up paying for your expenses on a weekly basis. So your last paycheck at the end of the month, that pays usually the monthly expenses plus the extra savings that you have. So for me, I've just felt like you never see your money all at once. It's like in little bits, which is slightly annoying, but it's a pro because I always have money. But please don't come at me and say, can I have money? No, I don't have money. I'm saving towards my monthly expenses, but it's just nice. And the fourth thing, or the fourth pro, is you get to choose the hospital that you want to work in and the specialties that you want to work in. Obviously, this somewhat depends on the this depends on the hospital or institution if they're going to have shifts for you. But in most cases, it works out. If you say you want to work in this ward and you have the experience able to work in that ward, most hospitals usually don't have enough staff in most cases, especially your government hospitals. They always need people every single day. If you've ever worked in a government hospital, you know every single morning and every single night at the matron's office, there's always like a long queue of agency staff coming in to do their work. So yes, in most cases you get the freedom to do that, so that is great. Okay, so now coming to the disadvantages. The main one is not having a regular shift. Like if you are permanent, means that some weeks you have a lot of shifts and some weeks it's going to be really quiet. So as much as you're getting paid on a weekly basis, the income is going to be very irregular depending on the number of shifts that you work that week. So one week is great and the other one is not. Hence, when I say that, yes, it's great to be paid weekly, but when it comes to your monthly expenses, it becomes a bit difficult because you need to be very disciplined with your pay every single week to say, yes, I can use this money to spend and so forth, but a big chunk of your money has to be saved up so that you have enough money to be able to cover your monthly expenses. So that's the only disadvantage, is you don't have that security as someone who is permanent, that, you know, at the end of the month I will have this amount, this is my salary. Every single week for you, it's going to be a grind to make sure that you're having enough shifts to be able to cover your expenses. So yeah, that part does get a lot of frustrating because the income is not as regular. The second advantage is, as much as it's great able to move around between different hospitals and different facilities, you're gaining experience and so forth, cool, that's great. But the disadvantage with that is you never feel at home. You're always unsettled because you will experience some nursing staff that are not very friendly with agency staff because they feel like you're sort of invading their home. You're a visitor essentially in all the wards that you're going to be working in. Obviously, if you become a regular in that ward, it becomes easier. But if you're going to be in that ward for a day or two and you move on, you constantly have to adjust to every single ward, to different personalities, different patients, different doctors, different nursing staff in every single ward that you walk into. So if you're someone like myself who doesn't adjust well to change, it can be very difficult. It can be very frustrating, irritating, a little unsettling, and in most cases you always feel sort of alone. Especially me, I'm not a very social person. Yes, I can greet you, I can make small chat, but I'm not that person who everyone is going to know my name by the name of that shift. I'm not out there. So it becomes very difficult to be able to build friendships and relationships with people because I'm like, I'm here for a day and then I'm gone. Most of the time they don't remember you and so forth, unless you make it like a big impact. Then like, oh my gosh, sister, please do come back and so forth. Cool. But in most cases, you're a visitor, you come, you do your work and you leave. There's no relationship, there's no fun. So just not having that family vibe that you have in your own ward does make it a little unsettling. The third thing, when it comes to your money, I'm going to make a video next week on how to budget as a weekly earner because trust me, it gets a little messy. Please be very vigilant with your money, as I've already mentioned, because trust me, it will look as if you're having a lot of money because every week you're getting money. But trust me, if you're not watchful and you're not careful of how you're spending that money, trust me, by the end of the month you're not going to see where any of your money goes, because every single week there'll be something new that you want to get because, well, I have the money. Next Thursday, sure, I can make up for it. And you always like comfort yourself, now, no man, I can make an extra shift for that, I just need one shift and then it covers these expenses, because you literally start using your shifts to say, okay, today's shift is paying for rent, tomorrow's shift is paying for transport. It works like that. So that can sometimes lead you to overworking yourself, because now you have to overcompensate for the money that you're spending, and you need more shifts to cover up for that. So it's very important for you to be vigilant with your money, but I'll cover that topic next week about how to spend your money properly and to keep track of it as someone who earns on a weekly basis. The fourth disadvantage is, as much as you have options to choose where you want to work, some disciplines just are never really short-staffed, or they're very iffy about taking on agency staff, and as a result they make sure that they're always staffed. So for example, your maternity wards, it's very rare for you to be able to be called in to work as an agency nurse in a maternity ward. So most of the wards that you be called into is your general, surgical and psych. Apparently they never have staff, so most of your shifts will be leaning towards that, and some wards that you might not necessarily get shifts in. So in most cases you will have to take what you get, because you need the work, so you gotta take what you get. Fifth thing is obviously the terms and conditions of working with an agency. If you're working with an agency, they're not obliged to give you leave, they're not obliged to pay for your medical aid, for your transport allowance, uniform allowance. Then there's another one, that money that they give you for if you're paying for a house and so forth. They don't give you any of that stuff that permanent staff get. As a result, the terms and conditions are pretty whack. You have to work 26 hours for you to get an hour leave. So getting leave is very difficult. And obviously, if you take leave, that means no money is coming in. So that is just one of those disadvantages that come with it, where you literally have to work every single hour, because that hour really counts for something. So that's just one of the disadvantages or uncomfortable things that come with it. In the video that I'm going to cover, I think in 2 weeks time, when I discuss the differences between government and private, the other thing with being an agency staff is you always be the least prioritized person in that ward. For example, with private, they have what is known as your nursing ratio. So nursing ratio, they say for every RN, they need to be catering for 10 patients. So if that ward has 9 patients, they won't need agency staff. So that means if you start your shift, you're at 12 patients, cool, there's a permanent staff and there's an agency RN. If the patients are discharged and there's 9 or 10 patients left in that ward, you will be told to go home, whether it's at 3, whether it's at 4, whether it's at 1. In most cases, they have to make you leave only after 1. So you know you're waking after 1, but if the numbers go down, you are going home. So you always be the first one to go home compared to the other permanent staff. So yeah, that's just one of those disadvantages where there's no... you're not tied down to anything. No one is obliged to give you anything. You're just there to do a job and to move on with life. So yeah, it does make you sort of feel unwanted in most cases, but yeah, anyway, you just take it and move on. And the last disadvantage is you will sometimes, or most cases, always feel like an outsider, because obviously the permanent staff, they know each other. There's just that whole camaraderie that come with them, and you sort of feel alone, sort of left out of things, because they'll be discussing about having like a gathering, or having a social and stuff like that, and you can't participate in any of those conversations because you're not permanent staff. There's highly unlikely that you'll be there again when that event happens and stuff like that. So you always be like a one-man island type of thing. You're always to yourself, and the permanent staff does their own things. They have fun and stuff like that. So yeah, you have some sort of, abandonment issues, being let out and so forth. So yeah, so these are the disadvantages of being an agency sister. Look, you need the money, you take the shifts, you work, and you keep it pushing. If you need friends, go find friends outside. The nursing staff, they're not going to be your friends. So if you can have that wrapped around your mind, then being an agency sister is going to be fun for you because it gives you so much freedom that I appreciate. Obviously, I'm aiming to become permanent somewhere. Because obviously there's more benefits that come with being permanent, and sort of having somewhere where you are stationed and not just constantly moving around. But if you're considering being an agency staff, go ahead. It's so much fun. You get to learn a lot, especially moving between different hospitals, learning of different personalities and stuff like that. And yeah, I would highly recommend it. So yeah, this is my 2 cents of how the whole process of signing up, getting shifts, and actually working as an agency sister works. If you have more questions, definitely comment down them below. But I feel like I've answered most of the questions that people have been coming at, that people have been DMing me about. So I hope this video is helpful to you guys. But yeah, don't forget to go down in the description box. I will list the most recommended agencies that you can sign up for, and also their day rate type of vibe, just to give you an idea of what to expect with those agencies. But yeah, if you have any more questions, you can definitely comment down below. So until next time, I never know when I'm going to post this day, so until next time in another video, I hope you guys have an awesome one. Bye guys.